Hello everyone, I hope all of you are doing well. This session will be about anatomy of liver and biliary system and gallbladder. By the end of this session, you will be able to describe anatomical feature of liver and biliary system and describe the feature of gallbladder anatomically and to discuss some clinical correlation and to memorize the blood supply and nerve supply of liver and gallbladder. Liver is the largest gland in the body. It lies in the upper part of the abdominal cavity and below the diaphragm. Liver has four lobes. It has right lobe, left lobe, and quadrate lobe and caudate lobe. The function of the liver is the secretion of bile, plasma proteins, detoxification of drugs, metabolism of fat, proteins, and carbohydrate, and also to storage vitamin A. In this picture, it is very clear. We can see here some part of the liver. We have the L is for liver, right and left part of the liver, and D for diaphragm, S for the stomach, transverse colon, and part of the small intestine. And also into the left of the screen, we can see here falciform ligament, liver, stomach, and granum omentum, or the policeman of the abdomen. Let us talk about liver surface. The liver diaphragm has diaphragmatic surface, which is related to the diaphragm and to the lungs, pleura, heart, and pericardium above the diaphragm, and also has anterior surface. This is related also to the diaphragm, to the anterior abdominal wall. The posterior surface of the liver is also related to the diaphragm, and the most important, the visceral surface of the liver is related to the right kidney, right suprarenal gland, first part of the duodenum, gallbladder, transverse colon, and fundus of the stomach. The right surface of the liver is related to the 7 ribs and 11 ribs. Here, this is the falciform ligament containing ligamentum teres, which is the embryonic remnant of left umbilical vein. Here also this is a falciform ligament, and so from this picture we can see here, and the falciform ligament again, ligamentum teres. We can see the falciform ligament divided, the peritoneal part divided into the right and left coronary ligament. You can see here the right and left lobes of the liver, and here is the gallbladder. This part is called fundus of the gallbladder. Here is the posterior surface of the liver. You can see here this is the area that devoid of the peritoneum is called bare area of the liver. The liver is completely covered by peritoneum except this part is called bare area of the liver. And also we can see in the left and right triangular ligaments and diaphragm. Also there is an inferior vena cava. Here is the visceral surface of the liver. You can see here from the left lobe and right lobe. You can see in the left lobe we have an impression of the stomach and impression for transverse colon, and we can see also impression for the right kidney and the right suprarenal gland, and also impression for the first part of duodenum on the side of quadrate lobe. And also we can see here between the fundus of the gallbladder and ligamentum teres, this is a quadrate lobe, and between the ligamentum venosum and the inferior vena cava, this is a caudate lobe. Here is the peritoneum, barrier of the liver and the gallbladder. Also this is a hepatic vein. We have 3 hepatic veins that drain into the inferior vena cava. And here this is a hilum of the liver and contain the porta hepatis. This is the H shape of the liver formed by gallbladder and the fundus of the gallbladder, ligamentum venosum, and the inferior vena cava and ligamentum teres. Here is the anatomical division and functional division of the liver, and the purple line, this is the bad liver anatomical division into the right and left lobe anatomically quadrate and caudate lobe. It are the part of the right lobe of the liver. And this is a green line, it is a surgical or functional division of the liver into the right and left portal lobes. Here is a hepatic vein. As I said, there are 3 hepatic veins and that drain to the inferior vena cava, and here is a portal triad contain bile duct, portal vein and hepatic artery. In this picture we can see here very clearly the part of peritoneum that adjoin the inferior surface of the liver into the lesser cavity of the stomach. This is called the lesser omentum. Also there is a gallbladder, and this arrow is showing this foramen is called omental foramen or epiploic foramen. That's the connection between the lesser sac and the greater sac, or between the posterior abdominal wall and the anterior abdominal wall. Through this passage or through this canal, fluid can be communicated, and this channel is very important clinically. This part we need to focus on it. This is important when we are doing liver surgery. We insert our hand and to clip this part of porta triad, or to clip the posterior, the inferior vena cava. And this maneuver is called Pringle's maneuver when you're inserting your finger in this part. And this is called epiploic foramen, is bounded anteriorly as you see by portal triad, and inferiorly by the first part of the duodenum. Superiorly is by the inferior surface of the liver, and posteriorly we can find the inferior vena cava. Is omental foramen, and this part is the greater omentum or the polys part of the abdomen, polisman of the abdomen. Here this is the celiac trunk, and which is branched into the common hepatic artery and to the hepatic artery proper, and hepatic artery with the common bile duct and portal vein. This form the portal triad. We will find the hepatic artery to the left and the common bile duct to the right, and portal vein into the posterior part of the portal triad. Let us talk briefly about blood supply and nerve supply to the liver. And liver is supplied mainly by hepatic portal vein, and it's also by hepatic artery as branch of the common celiac artery. And blood supply of the hepatic portal vein by the portal vein is come like 70%, and that with the hepatic artery like 30%. Sympathetically, nerve supply of the liver is come mainly from the sympathetic chain of T6, T7, T8 and T9, and parasympathetic is supplied by vagus, that shows right and left vagus nerve, that's forming blocks around the celiac trunk. Biliary system is formed inside the liver and it's come out as like right and left hepatic ducts, and those two ducts are joined together to forming common hepatic duct, and hepatic duct itself is joined with the cystic duct of the gallbladder forming common bile duct, and then bile duct is continually to join the membrane duct to form bulla of vata, which open the second part of the duodenum at the major duodenal papillae, which is guarded by sphincter called sphincter of Oddi. Let us talk about the gallbladder briefly. Gallbladder lies below the liver, and it store and concentrate the bile. It has fundus, body and neck. Blood supply to the gallbladder come mainly from cystic artery, which is branch of the right hepatic artery, and nerve supply that come the same that of the liver. And the most important point here, when there is pain that occur due to the pathology in the gallbladder, and this pain can be radiated to the epigastric region and to the tip of the right shoulder and subscapular region because of some nerve of the phrenic nerve and subscapular nerve. They contain the same root value. Here is the hepatopancreatic duct system. As I said, this is the right and left hepatic duct. They form the common hepatic duct which join the cystic duct, and they both of them form the common bile duct. And the common bile itself would join to the main pancreatic duct and forming the ampulla of Vata open into the medial duodenal papillae and guarded by the sphincter of Oddi. Here, this is the form of the stone that can be formed inside the bile, or it could be bile that concentrated inside the common bile duct. If the stone can pass down and to the block this side of the bile flow and can cause pain or biliary colic, and even they can block the pancreatic duct and causing some pancreatitis. In this picture you can see here very clearly, this is an ultrasound for the bile duct. You can see the wall of the red arrow from the left up to the screen. This is the thickening of the wall of the gallbladder due to the chronic pathology that occurring inside the gallbladder. And this one is down here and below. This is a stone inside the gallbladder, and this stone has a characteristic. This sign is called acoustic shadow. Acoustic shadow, or this is the characteristic of a stone that found inside the gallbladder in the ultrasound acoustic shadow. This is all about the gallbladder, biliary system, and liver anatomy. I hope it was very clear. Thank you very much.